So this is the only AI that I will ever recommend for you guys, okay? And that is called Metformin. You didn't know Metformin was an AI, did you? Well, it's not exactly an AI like anastrozole. So anastrozole, blocks the aromatase enzyme from converting estradiol into testosterone. Okay, it also blocks androstenedione from going into estrone. Okay, less known pathway, but what metformin does in ovarian and breast tissue, we know this is all from breast cancer research, is that it actually like regulates the actual production at the DNA level of the aromatase enzyme. So you could argue that it's actually superior. It actually reduces the amount of aromatase that's present in the tissue itself. Rather than just blocking the aromatase and leaving it intact, you actually create less aromatase when you have metformin on board. And this was discovered, it's been looked at for a number of different years, but this has been discovered, a number of years ago, and it's absolutely validated in a number of breast cancer studies in vitro and in vivo. And these are just two of them right here. So here we have the effect of metformin versus placebo on sex hormones in Canadian cancer trials, group MA.32. I'm not sure what that is. This is from the National Cancer Institute Journal 2021. And what they saw here is over the course of 6 months, women with breast cancer treated with metformin, so they dropped their serum estradiol levels. Where was it? By 5.7 picomoles per liter. Okay, so they had a decline. More impressively, in this particular study, this is a randomized controlled trial, clinical breast cancer in 2013, December. So metformin decreases circulating androgen and estrogen levels in non-diabetic women with breast cancer, because that's always been a question with metformin, right? I mean, we know it has all these great benefits in people with diabetes and prediabetes, but does it do anything in people who are non-diabetic? And the jury's still out on much of that in terms of life extension and stuff. But here, in this particular study, non-diabetic women, so they took 1,500 milligrams per day of metformin. They dropped their serum estradiol levels by 38%. 38% in this study. So a little less than the first one, but up to 38% here. Super interesting, right? Super, super interesting. So let's get into the nitty-gritty of the mechanisms. So this is Breast Cancer Research and Treatment 2010. Metformin inhibits aromatase expression in human breast adipose stromal cells via stimulation of the AMP-activated protein kinase. Trust me, we're not going to go into what an AMP protein kinase is. You guys can look it up if you want to. But this is where they start looking into, the actual mechanism. And it says it here in the title. It inhibits aromatase expression. Okay, the actual synthesis of the enzyme itself, which again is a slightly different mechanism than things like anastrozole. So, okay, in this particular study, they took cells in a petri dish and they incubated them with metformin, with insulin, or with a combination of metformin and insulin. And then they measured the aromatase mRNA expression, which is measures the synthesis of the mRNA enzyme, and then they also measured estrogen levels as well. Okay, so here's how they think metformin works. So this is a picture of the aromatase gene, okay, and it has all these little boxes here, these different regions along the gene that are called promoters. And when something binds or activates that promoter, it promotes the synthesis of the DNA that's encoded in that particular area. And what they have found is that metformin, it downregulates these promoters, but not all of them. So it downregulates promoter 2, 1.3, and 1.4.